Baldness, the facts. Male pattern baldness is a hereditary condition and is the most common form of hair loss affecting men. We're going to tell you all you need to know about the treatments available, from medication to surgery, with advice from Dr. Bessem Farjo, President of the International Society of Hair Restoration Surgery and founder of the Farjo Medical Centre. Causes.
Male pattern hair loss or male pattern baldness is the cause of hair loss in over 90% of cases in men. And you inherit the capability to lose hair in this pattern from both parents. In certain families you get hair loss at the front, the top and the crown of the scalp, whereas in other families you only get hair loss in the front or the crown, for example, and in some cases you just get a little bit of thinning, some cases you get complete baldness.
The full mechanism of hair loss is not fully understood, but it is thought that the hormone dihydrotestosterone, or DHT, is carried in the bloodstream to the scalp, where it causes certain follicles that possess DHT receptor cells to become smaller and smaller over time. This leads to eventual hair loss. Medication. Minoxidil.
There are certain medicines that can help with treating men who have male pattern hair loss. The first one is called minoxidil. Sometimes it is known as Regain, and this particular drug is now available over the counter. And the statistics show that if you use it in the correct dosage, it should give the male an 80% chance of slowing down significantly or even stopping hair loss altogether. However, the individual has to continue to use this drug for it to be effective.
Medication. Finasteride.
Another medication that is known to help with male pattern hair loss is a prescription-only medicine in tablet form, and it's called finasteride, and the brand name or the trade name for it is Propecia. And this is a tablet that is known to act against the male hormone DHT or dihydrotestosterone. And if it is used in the recommended dosage, the statistics show, or the research shows that you have an 80, maybe even 85% possibility that you can stop hair loss or slow down the rate of hair loss significantly.
Before taking or applying any medication, you should read all instructions carefully, and if in doubt, consult your GP. Hair transplant surgery.
Hair transplantation is by far the most common surgical procedure performed in the whole world for the purpose of restoring hair. The most advanced form of hair transplantation nowadays is called follicular unit grafting, and what that means is we take a small or a narrow strip from the skin, usually from the back or the sides, and that strip is divided into very small pieces, usually under microscopes, and those small pieces are then planted into the front or the top or wherever the patient's losing hair from. The operation is done under local anesthetic. It takes a minute or two of injections for the back, a minute or two of injections for the front to numb the area.
Hair pieces.
Other than medicine and surgery, there are other choices for patients, and it depends on the patient's lifestyle. Some people find that appealing and some people don't. But I always offer these choices to patients, even though I don't provide them. For example, there are the option of a hair system or a hair piece, and nowadays there are some very sophisticated systems, and I generally mention it to patients who either have very high expectations beyond what medicine and surgery can provide, or somebody perhaps who's lost far too much hair and surgery or medicine is of limited help.
Coping with hair loss.
Obviously, in my practice I see a big variety of patients, from the very young male who's beginning to lose his hair to somebody who's lost their hair in their 50s or 60s, and I mean, my oldest patient is in his 80s, and my job is really to counsel them properly, is to make sure they have reasonable expectations, because that's the best way to have a happy patient who's going to improve his self-confidence and be happy with the treatments that I've provided them with.